If you are confused about vaccines these days, you are not alone. The U.S. Department of Health and Human Services is considering significant changes to the vaccine schedule for children. It's dramatically revised recommendations on who gets the COVID vaccine, and it's even raising questions about the safety of vaccines. Here to help us sort all of this out and to give us some advice on how to stay healthy this winter is Dr. Ben Weston. Dr. Weston is the Chief Health Policy Advisor for Milwaukee County and an associate professor in the Department of Emergency Medicine at the Medical College of Wisconsin. Thank you so much for being with us.
Always good to be with you. Thanks for having me.
Of course, the Department of Health and Human Services is now raising questions about vaccines that decades of research have found to be safe and effective. What is the impact of these kinds of statements on the decisions that everyday Americans make about whether or not they get vaccines that they thought to be very safe?
Yeah, I mean, to your point with your opening comments, I think we're in a more confusing landscape than we've been in any memorable time in recent history related to vaccines. And of course, we want healthcare to be simple. We want vaccines to be simple. If we need them, we want to be able to get them, whether it's at a drugstore, at our doctor's office, or at our public health department. But of course, it's challenging right now. It's not just challenging to know what is going to be recommended, what is being recommended, where the conflict is there, but what's going to be covered by insurance, what's going to be available at your doctor's office or your pharmacy. So we can try to dive in and clarify some of that, but there are some answers or some areas where there's not quite clear answers yet.
Let's talk a little bit about the COVID vaccine in particular. The COVID vaccine, the recommendations have changed over who can get the COVID vaccine now. So currently, as of today, who is eligible to receive the COVID vaccine according to the federal government?
Well, here's where we are as of today. So we know the FDA has approved a new round of COVID vaccines in August. So we have an updated vaccine. It's more targeted to the current strain. So that's good news. Where it becomes a little less clear is on those recommendations. So there's two different bodies that kind of weigh in here. There's the Food and Drug Administration, the FDA, and then there's the CDC, specifically through the ACIP that you might hear about, a lot of acronyms, but it's the Advisory Committee on Immunization Practices. So let's take those one at a time. First, the FDA. Now, the FDA has put out guidance that the only folks that should get the COVID vaccine are those 65 and older or people with health problems. Now, it's worth keeping in mind those health problems include a lot of people. For example, it includes anyone with a mental health issue, anyone with obesity, anyone with limited physical activity, which isn't well defined. We could probably all use some more physical activity in our lives. So it is broad, but nonetheless, it is more restrictive than what we've seen in the past. And then each of the vaccines are a little bit different. The Moderna is 6 months older, the Pfizer is 5 years and older, and the Novavax is 12 years and older. So a little bit of complexity there. But where this really becomes more complex is the ACIP, that CDC, the Center for Disease Control and Prevention, that committee that really drives vaccine recommendations. Now, at the time we're recording this, they haven't made their decision yet. They're meeting on Thursday, but I would anticipate there will be changes coming out of that new committee. Now, it's not a new committee itself, but all the people on that committee are brand new because HHS has asked the old committee to leave, and all new people are on there with some different perspectives. So I think we'll get a change to vaccine policy coming up.
And is that potentially going to be vaccine policy overall, not just the COVID vaccine, but what we've seen and thought of as a regular scheduled vaccine, especially for children?
So it'll certainly be the COVID vaccine. I would be very surprised if we don't see changes to COVID vaccine recommendations. There has been talk of changes to the MMRV vaccine. That's measles, mumps, rubella, varicella. It's a bundled vaccine that you get typically in childhood to prevent you from from getting really sick from these diseases that can be disabling and deadly. There has also been talk just as of the last few hours about potential changes to the hepatitis B vaccine. This is a vaccine that infants have gotten to protect them from complications of hepatitis B for decades. So we'll see, but certainly on Thursday when the ACIP makes their recommendations, I think there'll be more to talk about. There'll be more changes that are taking place.
I think it's particularly confusing for people because these recommendations have been in place for decades. They're all backed by research that has shown the safety and the effectiveness of these vaccines. So to have these disagreements now really is causing people a lot of confusion.
It is creating confusion. And again, that's the last thing that you want when it comes to making health decisions. We want clear guidance that's evidence-based, and that's what we've had for decades. Hopefully that's what we continue to have, but we'll see when these recommendations come out. Now, to complicate this picture further, we have 14 different states around the country that are developing their own vaccine recommendations, putting together their own expert bodies, including Wisconsin, with an executive order from the governor to review vaccine policy in Wisconsin, make formal recommendations that are evidence-based on who should receive vaccines, and then also work with insurers to ideally provide that vaccine free of cost, but short of that, to be very transparent in what is the cost, what is the accessibility of obtaining those vaccines. So we'll see how that plays out as well.
And the whole idea of whether or not insurance is going to cover it, that can influence the accessibility for some people as much as whether the vaccine is recommended or it isn't recommended.
Oh, that's a major issue. It's one thing to say you can get the vaccine if you want to get the vaccine. Sure. But it might be more than $200 to get some of these vaccines. And for a large swath of our population, that crosses it right off the list, to be able to do that. And so whether insurance covers this is going to be a huge issue. And whether people know that insurance covers it. You don't want to go and get it and keep your fingers crossed that you don't get a bill for $200. You need to know ahead of time whether your insurance covers it, and if not, exactly how much you're going to pay for that vaccine.
One thing that we do know for sure is that COVID-19 is still with us and it's still in the community. What is the latest that we're seeing in terms of the prevalence of COVID-19 here in southeastern Wisconsin?
Yeah, that's right. It's certainly with us. And one of the things the CDC is still doing is tracking COVID. And so we see that from that it's not terribly surprising. There's this late summer, early fall increase in positivity and in cases that we're seeing. We're up nationally to about 10%. Now that's down from just a couple percent several weeks ago. It's not alarming numbers. It's not overwhelming hospitals or anything like that, but the numbers are going up. And when you have folks that are more vulnerable, when you have people who have medical conditions, who are immune compromised, who are older, this can be a real issue when COVID starts going around again and people start, once again, getting sick.
One question real quickly that hopefully we can talk about where there isn't any controversy, and that is the flu. The flu vaccine is out there. It's available. We should all be getting our flu vaccines, correct?
Absolutely. That one is clear. That one is correct. September to October is the ideal time to get your flu vaccine. So you can go out and get it today if you want. Pharmacies are carrying the flu vaccine. Your healthcare providers carrying the flu vaccine. You can check with your local health department, see if they carry the flu vaccine as well. So certainly you want to get that. Some people try to time it a little bit strategically. That's fine, but the most important thing is to get that flu vaccine. It prevents many hospitalizations, a lot of severe illness, a lot of death every single year.
Dr. Weston, thank you so much for walking us through this and helping us make some sense of it. And I guess the best thing we need to do is to continue to pay attention, and when in doubt, contact our physicians.
That's exactly right. And most importantly, get those vaccines. Get flu if you're eligible for RSV, get RSV, and certainly if you can, we'll see what comes in the days and weeks ahead. But certainly if you can, get the COVID vaccine as well.
Great. Thank you so much.
Thank you. Take care.